Hi, happy Tuesday. I hope everybody is doing well out there and preparing for Thanksgiving since that's just next week. I know I've got to make it by the grocery store and pick up a couple of things just to make sure I am prepped and ready. If you are planning on coming to the clinic next week, just a reminder, I'm only here Monday and Tuesday. I'm taking off Wednesday just to be with the kiddos and get ready for the holiday. And I hope everybody is taking some extra time to be with their families. So last week, I did kind of an impromptu session on dealing with the holidays, staying on track on weight, but I'm doing my best to not just talk about obesity, not just talk about weight management, even though those things are important. I want to bring other things into the discussion. And I'm involved in a nutrition network certification right now. It's a lot of hard work, a lot of paper writing that I've not done in over 20 years. So I'm using parts of my brain that I haven't used in a while. But the mentor that I'm working with shared a case study with me, and I thought it would be a great opportunity to bring this to light. And one of the reasons I think talking about mental illness right now is important, one, is because our world has a lot of mental illness in it. The rates of mental illness are growing quickly, along with every other chronic disease that's out there. But also moving into the holidays, we see increased rates of mental illness problems. There's usually a higher suicide rate. There is just higher rates of depression, anxiety. I did a quick research online trying to find studies on holiday stress. And it says that I found numbers as high as 40 to 60% of people experience extra stress during the holidays, either because they feel like there's expectations to be met, they're not able to relax, they're busy going, they're worried about, is their gift going to be well received? Is there going to be hurt feelings? A lot of times families are getting together that don't necessarily get together during the rest of the year. And all personalities don't mix, and there's family drama and bringing out family trauma and all these other things. So holiday times can be extra stressful. And then I remember this case study. It's like, this might be a great opportunity just to talk about how nutrition is more than just about weight loss. It is about your whole body health, and your whole body depends on what you put into it, and because food is really medicine. This summer at Low Carb for Better Health 2024, I had the amazing privilege of having Chris Palmer, Dr. Chris Palmer, as a speaker at Low Carb for Better Health. He's a psychiatrist that works specifically in this area. He recently wrote a book, Brain Energy. I've read it. It is very detailed. There were many pages that I had to read more than once, but I would encourage you, if you deal with mental illness or you have a family member that deals with mental illness, look up Dr. Chris Palmer on social media, listen to some of his podcasts, read his books, listen to things that he's put together. Because it really, when I started looking at his work, it brought to light the connection between nutrition and mental illness. And I feel like after I read his book, so many light bulbs went off, and I felt like I should have been seeing this all along, that there was a connection. And if you think about it, we see it at a young age. What happens when we give kids sugar? Well, they lose their minds, don't they? And bounce off the walls. Well, there's a reason. We're messing with their metabolism in their brain, even down to a cellular level. So this case study that I want to go over is specifically about bipolar disorder type 2. So bipolar disorder, it's a significant disorder. It's a major cause of mental disability, and a lot of people are on disability from it. And it affects the emotional and psychological well-being and causes severe distress. And it's categorized by periods of severe depression followed by hypomania. So there's bipolar type 1 and bipolar type 2. And bipolar type 1, think of extreme polar opposites. You have extreme mania. I call it the Energizer Bunny on speed, versus the severely depressed person who literally can't get out of bed, can't function, loses the ability to function in life. So bipolar type 2 still has those extremes. They're just not quite as bad. So it's not quite as manic. We don't go quite all Energizer Bunny on cocaine, but then we also don't go quite as depressed, but it is still significantly impairing. And for the people that suffer with this, it is distressful and interferes with their ability to have relationships, to hold down jobs, to prepare food, to function inside their families. It's quite disturbing. This case study was just put out in the literature in August of 2024. So it's a recent publication, and it's called Retrospective Case Study, Ketogenic Metabolic Therapy in the Effective Management of Treatment-Resistant Depressive Symptoms in Bipolar Disorder. Big mouthful, but it lets you know that this person had treatment resistant, meaning they weren't responding to the typical medications that were out there, and they had bipolar disorder, and they were using nutritional therapy to get it done. It was put out in the Frontiers in Nutrition. And the author is Nicole Laurent. I have met her. She's a very precious lady and is doing some great work out there for people with mental illness. So in this case study, it's the case study of a 53-year-old female that had bipolar disorder type 2, so not type 1. So she's gone hypomanic and depressed. She's had persistent mood instability and depressive symptoms that have been resistant to conventional therapy. And this patient had legitimately tried. She's done the psychotherapy. She's been in counseling. She's done mood stabilizers. She's done antidepressants. She's done all of the conventional therapy that she's been asked to do to control her bipolar type 2. She's even tried some nutritional therapy. She did the Mediterranean diet for a while, and these things were not helpful. Part of bipolar disorder is you don't sleep very well. And she had really instituted and tried to increase her sleep hygiene to make sure that her patterns and she could get and sleep a lot better. None of it helped. She'd also had these symptoms since childhood. So we're looking at a lady who has suffered with bipolar disorder for at least 40 years of her life, and she's only 53. So she'd had symptoms from childhood. When she started treatment, started this study rather, she was on ketamine. So ketamine has been used as an anesthesia or an anesthetist. So it's basically almost like a psychedelic, but it's a sedative at the same time. So we use it like conscious sedation or to deal with pain. And she was on ketamine. She was doing this every single week. She would go in for ketamine treatments because it can only be administered by a provider in a clinic. She would get 1 to 3 days of relief from this. That's not a lot. So she was taking time away every week to go in and do this therapy and only getting 1 to 3 days worth of relief. And the rest of the week, she was in these severe depressive side. She wasn't necessarily in the hypomanic a lot, but the severe depressive side. When she went to her psychiatrist, she actually brought up the idea of starting a ketogenic diet. So this is a patient that went out and did her own research, took her health into her hands, and was like, I got to do something. She presented it and said, can I try this? And thankfully, she was in the hands of a good mental health provider that was willing to work with her on this and had experience on it. When she started this intervention, they did a nutritional evaluation, and she was taking in between 200 and 300 grams of carbohydrate in a day. And if you come see me and you've done our weight management program, you know that there's about 1 teaspoon of sugar in every 5 grams of carbohydrate. So that makes this number seem like a lot, but honestly, this is the standard American diet. The regular American, everyday American is taking in somewhere between 200 and 300 grams of carbohydrate in a day. The author notes that this patient was not obese. She was not struggling with obesity. She was in a normal weight. And so she's going to be embarking in this journey not to lose weight. But, they're just making the point that she doesn't otherwise look unhealthy just from the outside. So in the initial screening, they use 3 different mood questionnaires, one for anxiety, one that does depression and anxiety, and one that is for PTSD, which this patient also suffered from PTSD. So in all 3 of these questionnaires, the patient's charts were significantly elevated. So she definitely has anxiety. She definitely has depression. She definitely has PTSD, and it's greatly impairing her quality of life and her well-being. When they started the intervention, they titrated her carbohydrates down over 2 weeks. So they didn't go cold turkey from 200 to 300 grams of carbohydrates down to 30 grams of carbohydrates, which is a ketogenic level. And these are total carbs, not net carbs. And that's very important because when you're using the ketogenic diet, not for weight loss, when you're doing it for diabetes, when you're doing it for seizures, when you're doing it for migraines, or for mental health issues, you need to do total carbohydrates. Net carbs are not going to get you to the ketogenic level that you need that's therapeutic enough to treat your condition. So they titrated her down over about 2 weeks. She increased her fats through natural animal sources, so started eating more meats that carried fat in it. And she also supplemented with MCT oil to make sure that her ketones got up. They were monitoring her remotely. They were seeing her every week, doing dietary analysis, making sure she was getting plenty of fat. She was monitoring ketones to make sure she was in the ketogenic diet. So this is the important part that I want you to hear. This person who was 53 years of age and had been suffering with bipolar type 2 symptoms for over 40 years saw significant improvement in her symptoms within the first 2 weeks of the diet. This is someone who's tried multiple treatments. They have failed everything conventional and they are resistant to it, to the point that they're having to get weekly treatments and take time out of their life and still only getting 1 to 2 days of improvement. So she's starting to see improvement in just 2 weeks of a dietary change. They followed her out for 5 months during this case study. And at the end of 5 months, she was still seeing improvements. In fact, they went back and did these questionnaires. So they did the one on anxiety, the one that was anxiety and depression, and the PTSD one. And she is now in normal ranges. Her screening is in the normal range. She talks about they had several patient quotes in here from this study. And the patient said that before this treatment, I just spent a lot of time very depressed and feeling withdrawn. She wasn't someone that was out there participating in life. She was withdrawn and pulled back. But afterwards, she's like, I just feel like a normal person. Yeah, I have stress. Yeah, I have anxiety, but it's what everybody else deals with. And guess what? I can deal with it too while I'm out there. She reported better quality of life and better emotional well-being. This is somebody that I would say was disabled, was probably not able to work. It doesn't say that in the case study, but my assumption is she was not able to function in society. And now with this nutritional intervention alone, can function back in society, can probably have relationships with other people where she couldn't have it before because she was feeling too withdrawn by the severe depression. But what are some things you need to know? Well, first, know that the ketogenic diet, or the keto diet, the true version of it, not the adulterated crap products that we usually use a lot of. I'm not saying they're all crap, but some of them are. It has been used for hundreds of years to treat epilepsy, to treat metabolic disorders like diabetes. This is not a fad diet. This is nothing that just came on the scene once and then is left and then came back on the scene. It has been out there for a long time and has been shown safe, but also because it's been shown in something that is epileptic, brain disorder, diabetic, metabolic disorder, you're not functioning well, you're metabolizing things. Okay, bipolar is also a brain disorder and a metabolic disorder together. So yes, it can be used in this. Food is medicine. This is something we forgot. Before we had all these nice and wonderful drugs out there that have helped a bunch of people, food was all we had, food and herbs, and we used them and we helped a whole lot of people. And we need to get back to realizing that food is medicine and treating it that way. It's been that way for hundreds of years. We just lost our way. But the other most important thing that I want you to take 2 things away. One, hope. So if you have mental disorders or you have family members that have mental disorders, there's hope, especially if you're treatment resistant. There's other alternatives out there, and it can be as simple as changing your diet. Not that changing your diet is simple, but the answer is simple. The treatment, not so much. But if you're using food as medicine, what happens when you stop taking your medicines? If you have really high blood pressure and you don't take your blood pressure for a day, guess what? Your blood pressure goes really, really high. If your diabetes is not under control and you stop taking your diabetes medicine, what happens that day? Your diabetes gets out of control. So if you're using a therapeutic lifestyle intervention like a ketogenic diet to treat bipolar or to treat epilepsy or to treat your diabetes or your high blood pressure or any of the other things that it could treat, and you stop for a day, you didn't take your medicine for that day. And therefore it gets out of control. So cheat days can't happen when you're using food as medicine. I'm not perfect. I admit that I'm not perfect. I'm not going to say that I have not had slips here and there, but I use my diet to treat a skin condition, an autoimmune skin condition that I've spoken very openly about. If I take a moment off, I will have a flare in that skin condition. Can other things flare it? Yes, but my food is my medicine. And if I choose to not take my medicine or to eat different medicine that's really poison more than medicine, I'm going to reap not benefits, but the repercussions. So if you are embarking on a journey like this, one, don't do it lightly. You have to commit to it. You cannot cheat. You can't waver from it, or it's not using as a therapeutic intervention. I also recommend you do it with a healthcare provider. Don't go about doing this on your own. Have someone that can be there with you and walk you through it, especially that you might be on other medications that have to be deprescribed or changed or altered while you're doing these lifestyle interventions. So if you need a provider and you're in the Tennessee area or any of the other 20 states that Clear Path Medical is going to be licensed in, and you want to use this diet to help you in your inflammatory condition, your diabetes, your bipolar, I'm not going to treat your bipolar, but I will definitely help hold your hand and walk you through making lifestyle changes to make sure you're doing it in a safe manner. So you can email us at contact@clearpathmedical.net, and it would be my pleasure to walk with you through your health journey. That's contact@clearpathmedical.net. In the show notes, you can find the link to this article. If you want to go through and read it yourself, I would encourage you to do so. Don't just take my word for it, but read the literature for yourself. That book, again, by Chris Palmer, was Brain Energy. Highly recommend it. Also in the show notes is the link to still purchase, not tickets, but the recordings for Low Carb for Better Health 2024. And you can listen to Dr. Palmer's talk. It was an inspirational talk. And there were some other great ones that week too. We might have to highlight them later, but you can find the link and go purchase them. It's $10 and you've got a full day's worth of listening of different topics to really dive into and learn more about. All right, guys, I hope that you have a healthy rest of the week. I have no idea what I'm doing next week, but I'll come up with something. I'll try to keep it off of weight management. It's really hard because I really like to talk about weight management. It's kind of my passion thing. But I will see you then. Until then, stay healthy.